everybody understands what we're talking about here, it used to be that the most common type of doctor was the family physician. You know, you'd go in, they knew you, they knew your family. Every once in a while you go to a specialist, but basically you were dealing with a family doctor. Increasingly, the economics of being a primary care or physician or a family doctor is a bad deal for a lot of medical students, because they come out with hundreds of thousands of dollars of debt. But it turns out that a primary care physician, as Kim just pointed out, their reimbursement rates are lower. The system doesn't reimburse for things like preventive care. If they stop one of their patients from smoking, they don't get reimbursed for that. But they do get reimbursed if they're a surgeon and they have to open up somebody's chest. Now, actually, that first part of it is probably more valuable to the person's health and to the society as a whole, but if it's not rewarded, then fewer and fewer people go into that branch of medicine. If we pass health reform, when we pass health reform, then and more people now have access to the system, it is going to be vital that we increase the number of primary care physicians. The best way for us to do it is twofold. One is to change how we reimburse. Change is in the delivery system. So what we're trying to do is we're trying to say, in all these systems, insurance companies, they should reimburse for preventive care. If a health system is making sure that a diabetic is taking their meds or monitoring their diet, they should get reimbursed for that, not just getting reimbursed for the $30,000 foot amputation after somebody, gets into real medical trouble. So one thing to do is to change reimbursements so that the incomes of primary care physicians are more comparable with specialists. The second thing is to provide scholarships and financial incentives for young medical students who are willing to go into the primary care field. We combine those two things. If we combine those two things, then we can change, I think, the incentives for a lot of doctors so that we get more and more primary care physicians.